Imagine walking into a hospital. You see doctors, nurses, patients, life-saving machines. It feels like the entire building exists for one purpose, saving lives. But behind every operating room, every MRI scan, every prescription, there is another world, a business world, one worth trillions of dollars. A world where billion-dollar corporations compete over hospital beds, where software is as valuable as medicine, where a single surgical robot can cost more than a luxury mansion, and where some companies make fortunes without ever treating a single patient. The surprising truth? The biggest winners in healthcare aren't always hospitals. They aren't always doctors. Sometimes, they're the businesses hiding behind every hospital. Once you see them, you'll never look at healthcare the same way again. Level 1. Hospitals are consumers, not just caregivers. Most people think hospitals make money by treating patients. That's true. But hospitals also spend enormous amounts of money. In fact, a modern hospital behaves like one of the largest purchasing departments in the world. Every day it buys beds, computers, scanners, medicine, electricity, cleaning products, food, software, medical gloves, needles, wheelchairs, security services, laundries, waste disposal, ambulances and insurance, construction, consulting, recruitment. The list never ends. Large hospitals can spend billions of dollars every year simply operating. Think about it. A single intensive care room contains equipment built by dozens of different companies. The ventilator, one manufacturer. The patient monitor, another. The IV pumps, different company. The software connecting everything, someone else entirely. The hospital is like an airport. Passengers see airplanes. But behind the scenes, thousands of businesses keep everything moving. Healthcare works exactly the same way. Hospitals aren't just healthcare providers. They're giant customers, and countless businesses depend on them. Level 2. The companies you never hear about. When people think of healthcare companies, names like Pfizer or Johnson & Johnson usually come to mind. But the hidden economy goes much deeper. Consider medical equipment. An MRI scanner isn't cheap. It can cost well over $1 million. Some advanced imaging systems cost several million before installation. Hospitals don't buy these every week, but when they do, it's a massive payday. Now multiply that across thousands of hospitals worldwide. Then there are surgical robots. One robotic system can cost millions up front. Then comes maintenance, software updates, training, replacement parts. Every year, more revenue. This is where recurring income becomes incredibly valuable. Sell the machine once. Earn service revenue for years. It's the same strategy companies like Apple use, only on a much larger scale. Then comes laboratory equipment, blood analyzers, DNA sequencing machines, diagnostic systems. Each one requires specialized chemicals and testing kits. Here's the clever part. Many companies sell the machine, but profit from the supplies. Just like selling a printer cheaply, then making money from ink cartridges. It's a business model repeated throughout healthcare. The machine opens the door, the consumables create the fortune. Level 3. The invisible supply chain, worth billions. Now let's go even deeper. Imagine one hospital performing surgeries every day. Every operation needs gloves, masks, syringes, surgical gowns, scalpels, catheters, sterile packaging, disinfectants, bandages, thousands of individual products, almost all of them disposable. Use once, throw away, repeat tomorrow. That creates constant demand. Unlike cars or smartphones, hospitals can't simply skip buying supplies. Patient safety depends on it. During the COVID-19 pandemic, the world suddenly realized how fragile this supply chain really was. Hospitals faced shortages of masks, ventilators, protective clothing. Prices skyrocketed. Manufacturers struggled to keep up. Entire governments competed for shipments. The crisis revealed something important. Medical supply chains aren't just businesses. They're strategic infrastructure. Today, many healthcare suppliers build massive global logistics networks. Warehouses operate around the clock. Deliveries arrive before sunrise. Inventory systems predict demand months ahead. A delayed shipment doesn't just affect profits. It could affect lives. That's why reliability becomes a competitive advantage. Hospitals remember suppliers who never fail, and those relationships often last decades. Level 4. The software quietly running healthcare. Now here's something most patients never think about. Hospitals are powered by software. Every appointment, every prescription, every lab result, every insurance claim, every patient record, every billing statement. Behind all of it, code. Without software, modern hospitals would struggle to function. Electronic medical records transformed healthcare. Doctors can instantly access years of medical history. Pharmacists receive prescriptions digitally. Specialists collaborate across cities. Administrators monitor thousands of patients simultaneously. But software companies don't simply sell a program. They sell subscriptions. Cloud storage, cybersecurity, data analytics, technical support, artificial intelligence. Hospitals rarely switch systems because changing everything is incredibly expensive. That creates customer loyalty unlike almost any other industry. Once a hospital chooses a platform, it may remain there for decades. Recurring revenue, predictable cash flow, exactly what investors love. Then comes artificial intelligence. AI can help identify diseases from medical images, predict patient risks, optimize staffing, reduce paperwork, speed up diagnoses, not by replacing doctors, but by helping them make faster decisions. Healthcare software is becoming one of the fastest-growing business sectors in the world, and most patients never even notice it exists. Level 5. The real business of healthcare. Here's the biggest surprise. The healthcare economy isn't built around one business. It's built around thousands. Every hospital is the center of an enormous financial ecosystem. Construction companies build new wings. Architects design specialized operating rooms. Banks finance billion-dollar expansions. Insurance companies process claims. Recruitment firms hire specialists. Universities train future doctors. Medical device manufacturers innovate. Logistics companies deliver supplies. Technology firms secure patient data. Cleaning companies prevent infections. Waste management firms dispose of hazardous materials. Food companies feed patients. Energy companies keep life support systems running. Every patient entering a hospital activates an entire economic network. Healthcare has become one of the largest industries on Earth, not because illness is profitable, but because delivering modern healthcare requires extraordinary coordination. Consider the numbers. Global healthcare spending reaches into the trillions of dollars annually. Only a fraction stays inside hospitals. The rest flows outward to suppliers, manufacturers, software developers, research firms, consultants, investors, service providers. It's an ecosystem where specialization creates enormous opportunities. Some entrepreneurs never invent medicine. They simply solve one expensive problem for hospitals. Maybe they reduce waiting times. Maybe they improve inventory tracking. Maybe they automate paperwork. Maybe they prevent equipment failures. Saving hospitals money often becomes a billion-dollar business. That's why healthcare attracts entrepreneurs from technology, engineering, logistics, cybersecurity, robotics, and finance. The biggest opportunity isn't always treating patients. Sometimes it's helping the people who do. Conclusion. Hospitals may look like buildings dedicated solely to medicine, but behind every hallway, every operating room, every emergency department exists one of the most sophisticated business ecosystems ever created. Thousands of companies work together to keep a single hospital running. Some manufacture life-saving equipment. Some write software. Some transport supplies, some finance expansion, some quietly maintain machines that patients never even notice. Most people only see the doctor. Investors see an industry. Entrepreneurs see thousands of unsolved problems. Economists see one of the world's largest engines of spending. And that's the hidden lesson. The biggest fortunes are often built far away from the spotlight, not by doing the obvious, but by serving the industries everyone else overlooks. Every hospital tells two stories. One is about saving lives. The other is about the extraordinary businesses making that mission possible. And once you understand both, you begin to see wealth differently. Because behind every great industry, There's another business quietly making it all possible.